right, this is the second half of the You Be the Doctor notes. We're talking about viruses now, and then we'll also talk about parasites. So the first one we're going to talk about is hantavirus. It's got quite a bad reputation. It is fairly deadly. So hantavirus is something that comes from infected mice or rats or contact with their droppings. We don't usually see a hantavirus in Minnesota. It's something more in the desert southwest. It starts with fever and muscle aches and eventually leads to respiratory distress where they have trouble with coughing, shortness of breath, and then their lungs fill with fluids. Approximately 38% of people who come down with hantavirus end up dying. Next is rubella. Rubella is seemingly mild-mannered disease. It's just a rash. It's caused by a virus, leads to a low fever, maybe a headache, and within 5 days, people are gone. People are cured of rubella, aka also known as German measles. And under normal circumstances, that wouldn't be a problem. However, it's a problem because it causes severe birth defects in babies where the mom is pregnant and the mom comes down with rubella. The babies can die from these birth defects, but also causes all of these different birth defects: eye problems, congenital heart defects. Microcephaly means small head. So the skull is deformed and then the brain is too small. So all kinds of terrible things that can happen with rubella. So the reason we get vaccinated against it is because to protect pregnant women and their babies. That's really why we want to be protected from it. All right, the next one we're going to talk about is influenza. Most people don't appreciate how incredibly powerful and dangerous the flu is. And that's because we haven't seen a really bad epidemic of the flu in a long time. The pandemic, pan means world, so that's an epidemic that happens across the world. The pandemic of 1918 killed innumerable millions of people. It happened during World War I. So anyway, flu is a virus that mutates very, very often. It's super difficult to make vaccines for. So we have to get a new vaccine yearly. And even then, sometimes the flu vaccine isn't perfect. I still get my vaccine every year just in case, just to get some protection. But it is not always a perfect vaccine because it's mutating so often. It leads to fever, major, major muscle aches. That's something that's super unique. People oftentimes can't even get out of bed. They're in so much, their bodies just ache so much. Sore throat, dry cough. Sometimes people think the flu equals vomiting, and that's the stomach flu. That's something totally different. That is not what influenza is. And the part that is surprising to many people is how incredibly deadly the flu can be, especially to the elderly, and to the young. They're usually the greatest risk for passing away from the flu. All right, next we're going to talk about yellow fever. Yellow fever is unusual because it's a virus carried by mosquitoes. The map indicates what areas of the world. We don't have the particular mosquitoes that carry yellow fever, so we don't have anything to worry about in Minnesota, although with global warming, those mosquitoes are moving north. So it leads to fever, muscle pain, leading to red tongue, face, and eyes. I guess that's all there is to say about it. Okay, moving on. Rabies. Rabies is one that I think most of you are familiar with. It's a virus that is pretty much 100% fatal. It's found in the saliva of infected animals. It starts with a fever and tiredness, eventually leads to difficulty swallowing, which is why we think of animals as foaming at the mouth. People get irritable, they become confused, and it's almost always fatal if untreated. There is a vaccine to prevent it for animals. We don't usually give that to humans. And it usually comes from bites of raccoons, skunks, bats, and foxes. And it's super important if you get bitten by an animal that you speak up right away. We had a student a number of years ago that was bitten by a raccoon and didn't say anything. And then it turned out that the animal did have rabies, and it was a life or death situation. They were able to get him medical treatment, and thankfully he survived. But it was a huge deal. So people make mistakes. It's okay if you get bitten by an animal. Say something right away. All right, dysentery is another diarrhea disease. We talked about cholera being a bacterial disease. This one is a viral, or actually, this one's bacterial or parasitic. Dysentery leads to severe bloody diarrhea, whereas the cholera led to severe watery diarrhea. Leads to diarrhea and cramps. It's also known as Montezuma's Revenge. And if any of you ever played the education video game called Oregon Trail, sometimes the pioneers that were on the Oregon Trail died of dysentery. So that's just something that made dysentery famous. Famous diarrhea, great. Okay, the next one is malaria. Malaria affects more than 500 million people every year. It's one of the most important diseases on the planet. It is a parasite, so we've moved on to the parasitic infections. It is a parasite carried by mosquitoes called the Anopheles mosquito. We do not have the Anopheles mosquito in most of North America, although again, with global warming, the Anopheles mosquito is moving further and further north. So it's carried by mosquitoes, usually found in tropical areas of the world. It leads to lightheadedness, shortness of breath, fever, chills, nausea, and flu-like illnesses. Um, when kids get it, they have to be taken out of school. They might get it several times in one year, and so it causes lots of interruptions in education. And it's really a very destructive disease. We've worked very hard to get rid of the Anopheles mosquito, but it continues to come back and develop resistances to some of the medications and some of the things that we use to treat it or to stop it. It can also cause pain, vomiting, and organ damage, eventually leading to death in some. Not everybody dies from it. All right, the next one is called onchocerciasis. Yeah, that's a fun one to pronounce. Actually, the more common name is river blindness, but basically, this comes from parasitic worms that are carried in the saliva of black flies. So, in primarily tropical areas of the world, again, when people get bitten by black flies, these tiny little worms basically make their way, they swim through the bloodstream and eventually make it their way into the eyeball, and then lead to blindness. It's a very gruesome and very sad way to lose vision, and one of the number one losses of vision that's contagious. So, yeah, leads also to an itchy rash, swollen lymph nodes, and obviously the loss of vision. Okay, next is schistosomiasis. Oh, I'm home. Somebody's at my door. Schistosomiasis is caused by a parasite found in snails that's in tropical waters contaminated with human feces. So keep in mind that a lot of these diseases we don't see usually in North America because of our good sanitation, our clean drinking water. And then also our access to medicine, access to antibiotics. Many of these diseases don't affect us, but schistosomiasis is more common in tropical areas of the world. It leads to stomach pains, bloody diarrhea, rash, and cough, and the symptoms depend on which organ the parasite lives in. So the parasite is found in snails, and then it moves through the body, and if it lands in the bladder, it causes one effect. If it moves to the liver, it causes different effects. Okay, and then this is the very last one, and again, super, super sad. This is called filariasis. It's a parasite that's carried by mosquitoes. I'm forgetting how to pronounce it. Filarial worm. I can't remember exactly how they say it, but it basically plugs up the lymphatic system. So you have blood vessels that carry your blood throughout your whole body, but you also have these other vessels in your body that are called the lymphatic system, and they basically carry fluid throughout your body. And these worms get trapped in the lymphatic system and they plug up the part of your body that sort of transports fluid throughout your body. And so that part of the body that gets plugged up starts to swell. And this is usually in the legs or even the genitals. And it causes extreme swelling. People are unable to walk. It's very painful. But it is curable with certain kinds of medications. But again, many people in the areas of the world where these diseases occur don't have access to those medications. They don't have good hospital or doctor care. So this swelling is also called elephantiasis. And that's it, everybody. So now you're ready to be the doctor. We're going to take you into the lab and have you take a look at some of the patients and see if you can diagnose them. Have a good day. Whoops.